What's up, guys? John here, Titan Lifestyle with Big Dru.
What's up, guys? Titan Lifestyle with John and girls. What's up? Great day today. More topics. More. We don't have any events coming up.
Dwayne Day? Yeah. What up, Pat? So
people keep asking me about events. When's the next event?
So we're putting we put this schedule together, me and Art, yesterday. You know, just a locked-in events, and yeah, there's a ton of them that are coming, and April's when it really starts to let loose, per se.
April 9th.
Yeah, April 9th's the first one. That's Mel Chancey Classic here in Tampa. So if you guys are in the area, what up, Big Irishman? What up, guys? How you guys doing? But yeah, so here we go. So Mel Chancey 4-9. Tampa Pro will be 8-4, 8-6. Now you're saying what is like 4 months in between. I've got other things in the works right now, just not locked in. These are confirmed, guaranteed, going to go on, and this is where we're at. You want to pull that one back up for me, Art? All right. So after that, we've got Tampa Pro 8-4. We've got Hurricane Pro 10-22. Olympia, Las Vegas will be in next year. What else we got here? CP Art and Fashion Show, that'll be in September. And then Cars and Couture will be 12-3-2022. We got to put these in chronological order, but that's kind of what we got going on this year so far that's confirmed. Now, there's other things that are going to be going on that, like I said, I got in the works. The other one is that we've just added, and I don't know if we'll be there in physical presence, but Tim Gardner called me up and he wanted to put Titan Medical Center as the title sponsor of the Caribbean Classic.
Puerto Rico. Was that
Puerto Rico? Yeah.
Puerto Rico,
yeah,
nice.
Yeah, so we're going to be on the medals and all that stuff for that NPC event, I guess, and we'll have like a table or something like that out there, but I don't know about us going out there because it's June 18th, and June 18th is like two other events that we got going on in first priority, and that's just because we booked them first, or is the way it is. Now,
right.
Deke Warner show is June 18th.
Oh, yeah, Mid-Florida or Florida State?
That's Mid-Florida. Mid-Florida Classic, and then we've got my son's birthday who's on that too as well. So yeah, it always falls on the same time of year. Anyway, guys, with no further ado, let's get going on some good topics that you guys are here and you guys want to hear about. So let's talk about the first one. Titan Medical Center's one of our healing peptide therapies, and that is TB-500. So this is a really awesome therapy, and this comes from like TB4 or TB-500 per se, right? And that comes from the thymus gland. That's where it originates from. That's what it helps for. Actin is the main protein that they usually find TB-500 or TB4 in. So at that point, it's awesome. It's great for a number of different things that you could be encountering injury-wise, from connective tissue to ligaments to joints to tendons, muscles, inflammation in the body. That's another big one that a lot of people do. Or if you have like wounds, like open wounds that are healing, this is great for that. After surgeries, this is great for that. So IBB Pro Neil said, I'll be at Deke's show. We'll see you there, man, for sure, 100%.
Holden Outlaw says you have his glasses on. Hope all is well.
You have my glasses on, yeah. Anyway, yeah, everything's good. I appreciate it. So, with that, TB-500 is amazing. Now, it works systematically. Jeez.
So you can sub-Q it then.
These things are really messing with my mouth, man. I'm going to take them out beforehand. Yeah. I feel like my mouth is changing every single day.
Oh, really?
So, yeah. So it's working,
though.
Yeah, no, for sure. Oh, it's definitely working.
Yeah.
But it's just the bite and all that. It's really crazy. But so TB-500 works systemically throughout the body. That means you can inject it pretty much anywhere, and it's going to work all the way through. And now, even with that, the best way to use it, I would say, is to usually inject it seriously closer to the injured area or soft tissue area. So at that point, it doesn't have to travel leaps and bounds. It's getting there closer and faster.
Shout out Dan Wheeler. What's up, Dan? He's saying what's up to us.
Big Dan, what's going on, dude? How you doing? Razvan, dude, he's always commenting. What's up, man? A whole bunch of respect to you guys, man. Yeah, absolutely.
Nice.
Yeah, man. He says all these gyms all the time.
Yeah, right. Nice.
It's awesome. Super fan for sure, 100%. So TB-500, like I said, great for connective tissue, ligaments, joints, tendons, muscles, inflammation in the body. It's awesome, and it works great by itself, or you can pair it up with PPC 157.
Now, you could put that, I know a lot of people have back pain. I'm actually experiencing lower back pain right now. I threw my back out earlier this week. How would I be able to inject my back?
Oof.
Like you say, closest to the area, but back here, it's kind of, there's not any meat back there, so it'd probably be best to do systematic. Because I know a lot of people have back problems. They always have back stiffness or anybody.
Don't go hurting yourself trying to inject in different areas that you possibly can't reach. Right.
So just go systematic with it.
Go sub-Q, and you can go like closest in your stomach or even be to the side. I mean, there's enough where it's, you're not injected a full ml usually in this at one time. So
definitely don't want to go into a tendon either.
No,
don't go closest to the area. Don't go into a tendon.
Yeah.
Push it. Make sure it's soft before you go in there. You don't want to inject in the elbow tendon or the tip of your elbow, get close to that bone or anything like that. Absolutely. Lisa, what's going on? Zabor, what's going on? How you guys doing? Athena in the house, what's up? How you guys doing out there? Swole Connect. Big Vin, Felix, what's going on? All right, so, you definitely don't want to inject into a tendon.
Yes, into a tendon.
It's a different type of pain.
Or directly into the area where it's hurting. Like, don't jab in the area and think, I'm going to hit that spot and inject it. Like,
around the area.
Yeah.
Off
So,
to the side of it or something.
Yeah, a little bit closer to the area. I mean, even for on top of the wounds, I know Jessica Azarello, when she got the really bad 2nd degree and 3rd degree burns on the outside, she was spraying it on there topically.
Oh yeah.
So it's another way where it was hitting, it was getting right onto the wound, which was pretty good. And
like it's like a sunburn,
Yeah, I mean, to a certain degree,
you have a sunburned face, make it into a mist and just mist your face.
That would be cool, right?
That'd be great. Yeah.
Oh man, but I mean, certain things like that, I mean, you can use it for, so it's really, really good. So if you guys want to use TB-500, it's really simple and easy to use, and our medical provider and our medical staff will walk you through all the different protocols and how to use it for what you guys want to use it for. You guys just let us know. It's simple to get as far as a patient-wise. All you guys have to do is fill out the new patient paperwork. You're going to do a medical consultation with our provider, and at that point, you guys can get TB-500, BPC 157, and a number of other different therapies without doing blood work. If you want hormones and stuff like that, that's going to need blood work. IGF-1, you're going to need blood work for that too as well.
I want to first give a shout out to Cece. If you guys don't know who Cece Ingram, she's world's strongest woman.
Oh,
600-pound deadlifter. I saw her deadlift 600 pounds for 4 reps in the cage.
Wow.
She has a tight waist. She's actually prepping for a show, and she literally today got her package. She got Titan Complete and Hercules. She sent me an audio message, unless you hear it afterwards. But she's sending people now. She's sending people now. So shout out to Cece. I hope it helps you with your prep.
Yeah.
And she said it was insane. She did Titan Complete and Hercules. I instructed her how to do it, and that.
Yep.
But yeah, she said it was insane. But shout out to Cece and good luck at your show.
She loving it?
Yeah. Oh, she's loving it.
Nice.
She's already sending me people, so I mean.
Oh, wow. That's awesome.
Great.
Yeah, that's the best thing you could possibly do, man. If you really, really like the therapies and stuff like that, tell people out there,
right.
How it can help them and stuff like that. Share your experience.
And that's how females can benefit from Hercules too. A lot of times when you see guys, Hercules.
Yeah.
She's a female, former world's strongest woman powerlifter. Now she's doing bodybuilding. And she's taking Hercules as she's leaning out.
Yeah.
So women, you think, I'm gonna take Hercules, I'm gonna get big, she's leaning out in the.
Yeah.
She says the workouts are crazy, and she's leaning out in the process. So you can get lean taking Hercules, and it's gonna give your stamina, strength, and everything pump.
Yes. It's definitely the way to go for sure, 100%, man. I mean, Hercules potion can be used by males and females, and it's not for bulking up, right? It's for quality lean mass and other great things like more strenuous workouts or getting that pump factor back.
Yeah.
And it's for the everyday person. Now, if competitors want to use it, they can really use it to their benefit. Because at that point, it should be a tool in your tool belt. Because when you're depleting down, and maybe some of these guys, and it just depends on what nutrition plan you're on. Your carbs are low or whatever it may be. It's hard to get the pump.
Yeah, when you're in a caloric deficit, you feel like crap.
Yeah, man.
But I mean, that Hercules keeps you full, keeps your stomach flat. So.
I mean, some of these guys are dehydrated. Low carbohydrates.
Yeah.
So at that point, they feel weak to a certain extent, and they can't even get a pump. Where this is going to help. Plus, it's good for different areas. Because the everyday guy is not really worried about symmetry, right?
Yeah.
But when you're a competitor, that's what they're getting judged on to one extent. So at that point, they need to be symmetrically perfect.
Right. Or if you have lagging body parts, or before you go on stage, if you want to pump up certain areas of your body without having to eat a whole bunch of food and have your stomach sticking out.
Yeah.
That Hercules potion, you could go no carbs, a light meal, and just spot where you need it, and your whole body's full and your waistline stays tight, and you have energy to be up on stage. A lot of times people go on stage they're so depleted. They haven't drank any water. They feel like crap, and it's hard to enjoy the moment. With this Hercules, you're going to have a pump. You're going to feel full, and it's going to give you a little boost, a little edge.
Absolutely. So it's great for all the way around. That's another therapy you guys can take advantage of. No blood work. Real simple and easy to get a hold of as far as that goes, as far as the patient. So, guys, give us a call or text, 727-389-3220. And we service nationwide except for Iowa and Ohio right now. But, guys, Ohio will probably be next week. I'm just letting that out right now for sure. So
all you Buckeyes, give us a call.
I just got to get the confirmation from the lawyers, and it's good. So that's what the meeting is next week. I'm pretty sure they're going to be like, go ahead. So, all right, guys. It's another one. All right, so let's get to the next topic. And this one's a pretty serious one for us males out there.
Yeah, I mean, male birth control. It's in the mix. It's going to start. They're going to start trials, human trials.
Yeah.
Women have like so many different birth control options. They have like rings and patches. They have so many different things, but we don't. Yeah. All we have is like a condom.
Yeah.
And that's like something that you can't. You have to wear. You can't just take it and perform without it.
For sure.
But now they're doing male birth control trials. It worked in mice. So now that it worked in mice, they're going to start trials in men. Mm-hmm. They say like 4 or 5 years before it's actually out there, like mass available.
Wow.
But I'm interested to see what the side effects are, since it's is it hormonal? Is it estrogen and all that? Like, I'm interested to see like what exactly it is.
Yeah.
But I mean, if it's safe and effective, I'd try it. But I'm gonna let the dummies try it first.
Male birth control pills. So I feel a certain way about this. I don't think that any male should do this, but listen, everybody's different. That's the great thing about being in the United States of America. We can all choose what we want to do. But at this point, so when we really look at this and we look at fertility rates, and I talked about this a couple of weeks ago on Titan Talk, where we talked about fertility rates have dropped like 25% in the last 20 years, I believe, or something like that. So at that point, like, guys are having more problems than ever even getting a girl pregnant as is, even if they,
because of testosterone
let loose and everything like
so much lower than it was exactly 20 years ago.
Yeah, so that was one point of it. Yeah, that was talking about testosterone levels and stuff like that, because if your body's not creating or sending a strong signal down to your testicles, basically at that point what's going to happen is you're going to have lower testosterone levels and you're going to have lower semen levels. And you increase that, and then that's usually what it is. It's an FSH and LH that increase. Yeah. And at that point, then you're going to up your testosterone levels and the semen production as far as volume and all that. So, this is a little different for me.
I'm interested to see if it's just going to like smash your sperm. Like, does it just kill your eggs so you can't get someone pregnant, or does it make you not be able to, like, I mean...
It says a non-hormonal pill, so at that point with no side effects. I mean, this is...
I don't believe that, no side effects.
Yeah, which led to the discovery that sperm count...
And the mice that didn't have side effects.
Okay, so this is going to kill your sperm count.
Yeah, it kills it. So it just basically smashes your egg. So if you guys don't know, a lot of men out there...
Eggs. You have
not eggs,
swimmers.
but I mean,
I don't want them to get this twisted.
No, not eggs, but I mean a lot of males out there... some guys that can't have kids, like their sperm isn't.
They're sterile.
Whether they have to take something to boost that or not. So this is like almost putting that. It's almost making you. I don't know.
Sterile.
Even though they say there's no side effects, I still feel like there's going to be side effects. I mean, there was no side effects in mice.
So
I mean, they haven't started human trials yet, which is going to start soon. So again, I'm going to wait to let all the dummies try it out, test it out first. But if it's something that works, I mean, I could see myself. I mean, I don't know.
Yeah,
I don't see why not.
What do you got to take this every day then? So at that point, it's kind of
it's like the women's thing has like a Monday too. Like you see how the women with like little plastic thing that has all the little days, and now you have a man with it. Yeah, it's just weird.
Dude, listen, I mean,
the only thing is it's not going to stop any STDs or anything like that. All it's going to stop is the ability to have kids.
I mean, so who takes this? A 16-year-old kid that we don't want him to get his girlfriend pregnant, or some 4-year-old guy who's already had 2 kids with 2 different marriages and like, I'm not getting nobody pregnant anymore.
Yeah.
Or you got some people out there that says, listen, I don't want to have kids, period. And that's usually a guy. He does a vasectomy, right? And tons of people do it. It's a very normal process that a lot of people do. So I mean, at that point, and that can be reversed.
It can.
In most cases, yes. But the longer that you go, the harder it's going to be. So that's just one thing to be on the table. But
I couldn't see reverse, and I feel like it would cause problems if
people do.
If it's reversed, I
people
feel like it
do
would cause problems.
Yeah, no. So, and people get people pregnant by doing that.
Mm.
So I mean, I know personal people that I know that I think you do too as well that have had this happen.
Yeah.
So at that point, it's pretty crazy. But I don't know. Listen, it's a new generation. Everybody has a choice. That's the beautiful thing about it. So if you think that you want this, and it might be available to you very shortly, a couple 4 or 5 years later.
How many guys out there would actually take it?
I want to hear.
How many people?
How many of you guys would want to take? Would you want to take a male birth control pill?
See, the thing is, now it's fresh to us. We've always heard about women doing it, so it's kind of like, But I mean, in 20 years from now, it could be the same amount as. So
let me ask you this.
I can imagine a girl ask me, "Hey, you on birth control?" Yeah, I got my. I'm on
all right.
So
now, have we flipped the script pretty much where? I hate to say it, but they're gonna be dominant in a lot of levels because at that point, girls were always the one that had to take birth control pills. Now, if they get in a relationship, you get in a relationship with a girl, and she's like, you know what, you're gonna take the birth control pills, and I ain't taking nothing. Yeah. I ain't messing with my body. I don't want no hormone fluctuations.
That's a good point because if it's not hormonal, they're gonna be like, I don't want to gain weight, I don't want to be moody, so you take it.
Now, guys are gonna start taking birth control, and females aren't. Yeah. I'm telling you guys. They slip this stuff in there like it's good stuff, and I'm telling you, it's going to change a lot of different things out there. Things are changing every day, and a lot of people don't even know. A lot of people are so busy working or don't even want to deal with negative news or anything that's going on, and they don't even turn on the TV or they don't read anything online about things. Just like, it's like the shiny thing. It's like, oh, yeah, look at this, but the real shit that's going on, I mean, I don't know. I think this would be a good option, but I could see it leading to some different things down the road. Okay. All right. So the next one, artificial sweeteners linked to cancer yet again in new controversial study. So, at that point, Big Irishman said if it works, I can still blast and have fun. Yeah, I hate condoms. Okay. So that's it. So let me ask you a question. So would you rather take a pill like this or have a vasectomy? Because that's the next one, right?
If the vasectomy and the pill were free, which one would you prefer? Because I'm assuming one of them is a lot more than the other. So people are going to choose the cheaper one.
Honestly, vasectomies I think are covered by insurance now.
Or you can join the military.
It's that common. VA will definitely do it. It's like they want people to do it. Yeah. So
it is true. It's like population almost control. It's like I saw the other day like they had a poll about all the major U.S. cities how much COVID has affected the population. Yeah. Like it's almost like they. And then now all this, it's just like...
It's like Thanos, baby. Yeah, about to do that snap on us.
Yeah, but birth control helps control the pregnancies you don't want, so it's a good type of population control.
To a certain extent, yes. 100%. I agree. Of course, listen, we don't want people that are 13 years old having kids. Or absent fathers. This is a good point. Yeah. This is a great point that you're talking about, Art. So absent fathers, 13-year-olds having kids, at this point where a 13-year-old can't take care of a kid, and then the kid that really needs a father is not there for them, or parents by that, any means. Kimball Slice.
Mad skinny saying Kimball.
We got to get this guy hired for a movie, dude.
I got to do. I shaved my head too, so I got the bald head and everything. I just wear this all the time. That would work. But another thing too with the birth control is like now, a lot of women will lie. They'll say they're taking birth control.
They're really not.
And then they're really not. And then next thing you know, they're pregnant. And they're like, oh, I don't know. Maybe I missed my whatever. So now it's like, I don't trust anybody. I could take it myself and have like, Hakuna Matata, no worries. That'd be good.
True statement. Yeah, I mean, you will get some girls out there that will say who they are, and they really
they'll even show you the packet and everything. Like, yeah, look, and this and that and all that.
They want to get pregnant. Or they really are inconsistent with their medication taking, and that can do it too. So I won't say that they're doing it on purpose, but sometimes they can, and sometimes other things happen. So it is what it is. You guys, think about this, and it doesn't really matter because we got 4 or 5 years, so this is going to come out. But at that point, your kids might be taking this. You never know.
True.
All right.
I could see in high schools or something like that.
Right. So back to artificial sweeteners. So artificial sweeteners are linked to cancer yet again, a new controversial study. So there's a big study out there that was done, and basically it was done on a major group of people. It was over 100,000 people that this study was done on. And, the main point of this whole article and what they were telling us is that it's a 13% more chance that somebody's going to get cancer drinking some of these sugar substitutes, right? These artificial sweeteners. And these are in a lot of different things. So, that's I guess that's a risk that everybody has to take. You know, they did take an accountability because when they were studying these people, there's other variables that take effect that could cause cancer possibly. You know, think about people that smoke, right? Or they have other lifestyles, or even where their job is, that they could be, you know, coming in contact with something that could possibly expedite or spur cancer. So at this point, 13% I don't think is that high. But, you know, with this, it's still something, right? It's something that will increase, you know, the risk possibly. And you might have other risks that are going against you too as well, like people that have, you know, their family history of cancer that runs in their family, whether it be breast cancer, prostate cancer, all these different things. These are things that we have to, you know, literally watch out for. So, you know, what's the best way to do this?
I feel like there's some sweeteners are better than others too. I mean, like aspartame. I mean, it's really not a good one. It's what they use in Coke Zero. I used to drink Coke Zero. Like
that's the one they're talking about mainly.
I used to drink Coke Zero by literally a case every day, 12 every day, 6 meals, 2 cans with every meal.
Wow.
But now I don't really. Every once in a while I have a Diet Coke or something like that, but just a little bit, give me some fizz. But try to stay away from sweeteners lately. More natural fruit, honey, you know, natural sugars.
Yeah.
I feel a lot better, and I don't have to. Plus, inflammation from all those sweeteners too kills your joints.
That's what I'm saying. That's another thing. So I mean, you know, if it's doing that, think about other things that it's doing unhealthy, you know, to your body that we don't even know, that we don't, you know, we're not feeling at that point in time, but it's causing some damage there, you know.
Yeah, I noticed a lot of inflammation when I cut it out. Someone mentioned it, and I was like, yeah, you're right. I haven't really had that much, you know, pain in my elbow and stuff. So
that's good, man. So I'm you know, I'm glad. But I mean, you know, so I understand some people out there, you know, want to drink this stuff and they think it's a good substitute for them not drinking regular Coke or whatever it is, because this was the main one they were talking about was Coke Zero in this study. So with that, you know, it is what it is. Now, even the National Cancer Institute in the UK both said that sweeteners do not cause cancer, and that's why they've been authorized by the use of the European Food Safety Authority. So at that point, I don't know. You know, at 13%, that's not. It's still a risk, but it can cause other issues, like Drew talked about, inflammation, these other different things that could be doing harm.
I don't understand. I mean, they're testing everything on rats too. I mean, a human is not a rat. I mean, they could do it to a certain extent, but I mean, if they're not testing it on people, they're testing it on rats. And they're like, oh yeah, it's effective. Let's try it in humans. So until I see the tests, whether it's birth control or sweeteners or anything, until I see the test done on humans, then I'll you know, take it more serious, I guess. Or believe it, I guess, more.
Yeah.
Because you can give a cow anything and it doesn't get side effects.
It's true.
So they can't be like, oh yeah, we gave it to the cow and it's fine, so you could take it. I'm not a cow. You know, so it's a big difference.
This is true. All right, so the case of the $489,000 air ambulance ride.
Crazy. $500,000 ambulance ride. The guy was I think he was in like rural Wyoming, had a medical condition, and he had to be airlifted to Colorado.
Wow.
So it was like, I mean, all in total, it literally came to almost $500,000 just to transport him there from Wyoming.
Yeah, he had aggressive leukemia.
Yeah. So I mean, I don't understand how it could be that. I mean, that's crazy. I mean, I don't get it. Wow. Even when I read the article, I still didn't get how it could be that high. They said 70,000 was I'm not sure what it was, but that's just ridiculous. 400. I had an ambulance ride one time and it was like $1,000 and it was like a half mile down the street.
Yeah. Oh yeah.
It was literally like a half mile down the street. So I mean, $70,000 for ground and the rest was air. Yeah. So over $400,000 in air.
Yeah.
That's crazy.
It's
and not only that, the guy had a terminal illness. Now he has to pay. You know, he has to pay his medical bills, and I mean, I don't know about insurance and all that, but he has to pay that. That's $500,000.
Yeah.
So you get whacked with $500,000 after you find out you have cancer and terminal illness. Like, whoa.
And some people don't have insurance, so you know, at that point, if you don't have insurance, then you know you get hit with these big payments, and they try to say, "Oh, we're going to take this much off," which is really, really crazy. And
I mean, even if they take $400,000 off, you're still paying $89,000.
No, I know.
That's crazy.
I know. You know, and he was visiting his father, and he became ill when he was visiting his father in his rural Wyoming, I guess. So at that point, it's pretty crazy what happened. It's nuts. But you know, this does happen, and you know, I mean, this is why. You know, some of the different things need to be looked at. But remember this: all these different things, like even ambulances, right? They're privately owned. They're not owned by the state. They're not owned by a government. Nothing like that. So it's all capitalism. And at that point, they're marking things up like 1,000% or more.
Yeah.
You know, it's really crazy. It's even funny. Like I'll run the blood tests that we run on us, And even when I go to the veterinarian, okay, they run the exact same blood tests they run on us. Okay, so if they run like a CMP or CBC, which I think we would charge maybe like $20 or $30 for here, it's like $300. You know, so it's and I know the costs, and I'm like, wow, I'm like, this is really, really crazy the way it is.
It's another reason why people don't mess with medical type of stuff.
Yeah,
a lot of times people
we got
just avoid a problem or not even do it just because they're like, it's too much. I'm not doing that. Like, I'd rather have whatever the pain or whatever is than deal with the pain of having to spend that much money on something. So
these are pretty good. So Pat Russo, our man out in PA, coming to Florida soon. He said we had two guys, and he's a state trooper there. We had a guy 2 weeks ago who accidentally shot himself in the leg, drove himself to the hospital because he didn't want to pay the ambulance bill.
Wow.
This dude would rather bleed out in his car
that's big.
Then go in an ambulance because he didn't want to pay the bill.
See, I could see if it was like close, like if I could drive and it's like, you know, a 10-minute.
Yeah,
I probably would.
Yeah, I think
unless
I probably would.
I've got shit in the chest or there's something crazy. But if I look down and see a hole in my leg, and I just need to hurry up, I could sit there and wait.
Yeah.
Or like I'm like in 10 minutes they could be here, or in 10 minutes I could be there.
Yeah.
So
I think I'd go too. All right, Seth Jordan said, what do you think about Peptide and AOD 9604? Pat, I love the stories too. If you got any other good ones, share them with us. So what do you think about Peptide and AOD 9604? So peptides are awesome. Peptide therapies work in a number of different ways, and we're talking about one of the healing ones today, TB-500. But we've got sexual peptides like PT-141, which is FDA approved for female libido enhancement. And then we have other different peptides, like one of our weight loss ones, AOD 9604. So this is a really good one. You know, it's a 176 amino acid chain, and it works in a great number of different ways where it helps with lipolysis and lipogenesis, so destroying fat and helping your body not store fat. So that's even better, right? And literally using it as energy. So so this is some of the different good components, and it doesn't have any negative side effects with it either, and there's hardly any contraindications with it as well. So something like this is going to work really, really well with patients, whether you're looking to lose 10 pounds or 100 pounds.
And that could be combined with ECA and semaglutide.
Just going to go to that. Absolutely. So
semaglutide is killing it right now. I mean,
it is, dude.
If you guys want to step it up, throw some 9604 in there.
Yes.
And if you really want to step it up, throw some ECA in there.
Yes.
And you'll be a machine. Absolutely.
Cody Durr on the house. What up? Bianca, how you doing? Ricky, Christian, what's going on? Naster, Big Arson said $3,000 for an ambulance right here. Had to once. We'll never do it again. Drive me dead. Damn it. Oh, that's funny. All right. So, what would be faster absorbed, injectables or more topical? So, obviously, you're going to want to go with injectables. Injectable is going to be the best way to get it in the body. You're going to have a higher absorbency and a faster transportation rate by doing this. Orally can be done, and we do it as a therapy for people. It's just not as good as an absorbency rate as far as what you're going to get from an injectable. So that's the only reason why I say that. But it works either way. But like I said, if I want the best, I'm going to do it the right way, and I'm going to do an injection. All right. Quick acting. What was the one with Drew? Was there a comment for Drew from...
Yeah, someone said they saw me from Fit for 10. I look a lot smaller. I don't like that. Someone said, yo, Big Dru, I remember seeing you at Fit for 10 a few times. This video makes you look a lot smaller than you really are. Respect to you.
Oh, okay.
I appreciate the respect, but I got to eat more, I guess.
Yeah.
People know me. That's going to get in my head, so...
He's having
you'll see me 10 pounds bigger next week regardless. Watch. Like that really gets in my head when people say that. So
you guys, man.
We'll see.
Oh, man. Drew's been dieting, man. He's been dieting lately. Now you guys are going to give up his diet. You guys messing with his head.
I'm messing with all of it.
All right, so the next one. Caitlyn Jenner says the trans swimmer Lia Thomas is not the rightful winner of the NCAA title, which she got as the best swimmer. Or, as far as winning the swimming contest as she did. So this is, I guess, do we respect this? Do we not respect this? And I think that we should respect this by Caitlyn Jenner, who's a trans woman, and or might be all the way converted. I don't even know at this point. But who was Caitlyn Jenner beforehand? And Caitlyn Jenner beforehand was Bruce Jenner, who was an Olympic gold medalist. Right?
One of the best athletes, all-around athletes in the world.
I mean, come on.
Multiple
triathlon. I mean, come on, dude. When you do this, you're doing multiple things, not just one sport. Yeah. You're doing 3.
Yeah.
Okay? And it's not something easy to do either. I mean, so at that point, this guy went from nothing, got a gold medal. I mean, and at that point, when he was doing that, sponsors, there wasn't really hardly any sponsors, man. I mean, I know his wife at that time, who was not the Kardashians' mom, but at that point, she was like basically fitting the bill for everything and supporting him while he could just train and do all this stuff. And then after that, goes on, marries, Kim Kardashian's mom, and at that point, becomes Caitlyn Jenner.
Yeah, I mean, just imagine if Caitlyn Jenner would go compete against.
Well, that's
say if she was younger,
yeah,
and she transitioned like right after she won those, triathlons and stuff.
She wouldn't though. That's why she's protesting it.
Yeah.
No, but I'm just saying in terms of disadvantage. Can you imagine the disadvantage?
Yeah.
When she's winning all those triathlons and sporting events, and then a year later she transitions while she's still like young.
Yes.
Yeah, it would have been like domination.
Yes.
And that's literally what's happening now.
This is what's happening now.
This
is exactly what's happening now. I mean, I just it's crazy. It's really crazy out there what we're going through and seeing some of these different things. And I don't know. I mean, I feel like men are more upset about it than females are more upset about it, and I just don't know. Even I talked to Sharice about this last night. I'm like, dude, do you understand this? Like, because I feel like, I'm saying more about it than you guys should be saying more about it. And how long have women fought for equal rights and
it is
equal
true. I hear
opportunity, and
I hear more men talk about this.
You hear more men talk about this because you know what? We know it's not right, and we're gonna say it to you guys, and it's not right. Okay, it's not right. Like, it's fine. Like, just incorporate one sport. We'll put girls versus guys right off the bat, and then we'll see what happens. And it's not gonna be good for girls. It just isn't. So if you put men in transition to girls into girls sports, it's even worse, man, because they really stick out like a sore thumb. So for her to come out and say all this, I think it should ring the bell for everybody else, and they should understand that maybe on the fence or against it per se, and want trans females, men that are transitioning to females, be able to participate in female sports. I mean, it's taken away from all what females have fought for to this point in time.
Yeah.
It really doesn't matter. I mean, because if males take over female sports, I don't care what they say, by genetic standard, it'll be a male-driven world in every way, shape, and form.
Yeah. Yeah, it's true.
We'll control it.
Yeah,
I mean, it is what it is. Guys will control it because you're not going to see females transition to males and make, or maybe we will. I don't know.
But if a female transitions to a male, it's going to be like they're going to be beat. Like if a female transitions to a male in like powerlifting, like you could take a guy that doesn't even work out and still beat him.
Yeah.
So I mean, it's like male to female is an advantage, but female to male, I can't see that being any advantage. Like I don't know any sports out there that are time, distance related or any weight related, whether it's track and field, swimming, anything, that there's a female time faster than a man.
Yeah.
Track and field, every single event, the male is dominant, and if you look at the times, the distances, every single event.
Yeah.
So it's like it's never happened where a woman has been as athletic as a man.
Yeah.
Ever. So if a woman transitions to be a man, and she's like.
Yeah,
she's like total disadvantage.
Well, I mean, look at what's going on here. I mean, these guys are transforming into females, and that's their God-given right. So they should be able to do it. But when they're competing, they're going, they're okay as a male, and then they go into females, and they just win everything.
Yeah,
it's not right.
Or like
it's not right. And I don't blame the school. Because I guess the school is like, hey, listen, we're going to win every meet, and that's what it is.
Yeah.
So, I mean, they're putting their best player. If they can use that and it's legal to do, I guess, I mean.
But they can also use it as a means to go to college for free. I mean, if you're in high school and you're trans and then now you want to go to college, you could just become a female, take a year off, do your estrogen or whatever you have to do, and then now you could enter an NCAA college, go to school for free, get a scholarship.
This is a prominent college.
You can go to get college paid for, and then once you're done with college, you'll be like, oh, I'm gonna be a man again.
Yeah.
Get your school paid for, break every single record, and then if go back to it.
Yeah, so with this, or maybe they should institute this, and I don't know if they already are to some of these athletes and stuff like that, but if they're truly going to transition, what's the definition of their transition, right? So are they just going to identify as a female, or are they going to be on a medical regimen per se, where it's killing testosterone levels and raising estrogen levels, and then they're going to be competing? That might make a difference to a certain extent, but if they're just saying, hey, listen, I identify as a female, I don't want to do any medications because that's my God-given right not to say that, but and they compete. I think that's, I don't know. That's I don't know. It's crazy.
I think 14 out of 16 of the teammates actually signed a petition against it.
Oh yeah. They do not want it, for sure, 100%.
They're her own team,
So I mean, at that point, like, we should listen to the females out there because it's their sport.
Yeah,
it's their sport.
true.
The females are not going to come in our. I don't know any girls yet that have came into the MLB and been able to pitch as fast as an MLB pitcher. Now, underhand softball, that might be a totally different ball game, but I've never seen a girl come in and throw an overhand
No, they
ball
don't.
that fast.
Underhand softball, they're like 70s is like the highest they
You know?
get is like 70s for females that I've seen.
Yeah.
So that's like literally 30 miles an hour slower than a male.
Or face a pitcher that's throwing 100 miles an hour or 99 miles an hour. I'll make it a little bit easier for you guys.
Yeah.
Hitting a fastball coming that quick to them,
And the ball's smaller too. I mean, softball, they're like it's
true.
It's big, so
It's
they're
true.
like making it. They're literally making it easier to hit the ball.
It's true.
So all this equality, this and that. Then
Yeah.
why don't they just have female baseball? They have female basketball, but the basketball is smaller. So
Yeah.
it's like everything is
It's true.
modified for females.
It's true. And that's okay. That's all right. We want females. We want, listen, I believe in females.
Yeah.
And, even in here in the office, I was telling Therese the other day, I'm like, man, most of the staff is females. And that's okay with me, because, listen, I want those girls to do good, too. So I want girls and guys that, to be on the same level, but guys going over to female, I think guys hate it even more because we feel that is cheating.
Yeah.
I don't care about any steroids and all the guys are in the guys league they're doing. Let's say it's baseball, whatever it is. But when you start doing this, it's seriously cheating.
Yeah, when you go from being ranked 400 to number 1, breaking records.
That's cheating, guys. I don't like cheaters.
Yep.
So, all right, guys.
We got a comment on the YouTube.
What do we got?
Cleared that up for Drew.
Said, I'm saying you look huge in real life. The video's making you look smaller.
Oh.
Yeah, boy, I'm going to eat after this. Watch. Next week, I don't care if I can't breathe. You guys are going to see me heavier. Watch.
I promise you, this guy is not smaller, guys. Relax. I listen. It's at least they're not. I guess it could be two different ways, right?
Now, he's just trying to be nice because he knows it gets in my head. So, yeah, I mean that's clear. That's clear. It was a good chop, but you already said what you said.
Oh shit!
Might get blocked.
All right, guys. We're gonna end it on that note. It's been a great tight lifestyle, Big Dru here every Friday, 2 p.m. And it's been awesome having you guys on here. I appreciate everybody that's chimed in or even came out and supported us and just watched us.
Yep.
So
shout out to real quick to Big Irishman. He tags so many people every show.
Big
Nice.
Irishman, much love to you, dude, as
Shout
always,
out to
man.
Big Irishman. And also, guys, make sure you check out our YouTube. Hit the bell. Make sure you subscribe. If you want to check out the podcast to listen to all of our shows, we've done like over 100 shows. So if you guys want to listen to those as well, and also check us out on Facebook. And we'll be back next week at 2 p.m.
2 p.m. We'll see you guys.